Do stay with us.
Well, that's certainly what we're sinking our teeth into right now. It would seem that we're at the start of a third wave, and right now we are dealing with a strain which has been identified as a strain of concern by the World Health Organization. So far, the numbers are not looking good. We've recorded 851 cases in 2 days and 11 deaths, 11 people dead in 1 day. So Lagos State did say before now that they were recording an average of 6 deaths per day. So definitely something to give us a lot of concern and something which we shouldn't just take lightly. How can we curb, the spread of COVID-19, especially this particularly dangerous Delta variant? We have with us this morning Professor Miriam Aminu, who is the head of Department of Microbiology, Ahmadu Bello University in Zaria. And she's also the Deputy Dean, Faculty of Life Sciences, Ahmadu Bello University in Zaria. She joins us via Zoom. Ma'am, you're welcome to the program.
Good morning, and thank you for having me.
Good morning. We also have with us right here in our Abuja studios, Dr. Arkelia Ishako, who is an epidemiologist and also a senior lecturer at the Nasarawa State University. Dr. Ishako, welcome to Sunrise Daily this morning.
Thank you, Maokwe, for having me.
Well, this is the news that we have now. And it looked like, COVID-19 was tapering down. All of a sudden, we're hearing of a third wave. We've seen how it has dealt very deadly blows to some countries, and it would seem that it is now right here with us. What has happened? Did we let down our guard? How did this particular virus come back so virulently?
Yeah, so just like you used the idiomatic expression of lowering down our guards, is because we have actually opened up our borders, both land and air borders and sea borders. And we abandoned our non-pharmaceutical intervention measures. We, Nigerians just have a nonchalant attitude towards the COVID-19 preventive measures. In fact, the no mask, no entry has become a gate pass only for people that just want to enter corporate vicinities and all what have you. So on the individual side, we have lowered our guards. Even on the government side, we have lowered our guards in terms of not going into aggressive surveillance. Maokwe, if I asked you the national question, how many samples have we tested? You'll be surprised that we have not tested enough. Still up to today, some states are not even logging in samples. They are not testing. So our testing profile has gone down. We are battling with a major threat to public health, which is misinformation and fake news. The issue of vaccine hesitancy is there, lower coverage of vaccine. So it is like a confounder of so many multifactorial factors that has actually impede the fight against the COVID-19. And then here are we on a third wave due to circulation of a Delta variant, which is the transmissibility profile is very high, and then it has a very short incubation time. If we learn from India experience, if we learn from other countries that have battled with Delta variants, Nigerians need to buckle up, because more cases, we are going to experience more seropositivity cases. And then another aspect that we have neglected too is on the mortality surveillance. So we have to look at our death rates, our case fatality rates. How many people are dying? Where are they dying? Are we actually doing autopsy, the oral autopsy and the normal autopsy? So we need actually a national policy now to be able to nip this on the board.
Well, I don't know whether this is already grown into a full bloom flower, you know, because nipping it in the bud, when we're seeing already 11 deaths in one day, this is now becoming some average of sorts. But let me come to you, Professor Aminu. Dr. Ishaku here has laid the premise upon which this Delta variant is spreading. Now, if we're to sort them out one after the other, are you happy with the steps that we're taking so far to try and to put a lead on the spread of this particular variant?
Thank you so very much. Well, the government need to scale up the testing ability, because as I can see that the RDT, the rapid detection test they have deployed, it is being used in a few states. It is very, very important that they increase all states. They should deploy that rapid test to be used in all states, in all workplaces, in orientation camps, in schools, every facility where people crowd together. They have to scale up the use of that RDT to quickly detect and detect cases, their contact, and also do surveillance. Surveillance is very, very important. I think the federal government need to scale up the surveillance part of this COVID-19 fight, because I think that is what they are not doing right. Vaccination, we know, is very, very important. It's another one, because there are a lot of misinformation concerning the vaccination. I'm happy that the Moderna vaccine is here, and I hear that we are going to have the AstraZeneca we are going to have that too, and we are going to have the other vaccines that are coming up. The most important thing is that we should ensure that all individuals that are eligible get vaccinated. And the right thing to do, which we have not done, which the government has not done, is to reinstate the use of masks, to mandate the use of masks. This is highly important. And because, like Akiala said, we opened our borders. You know, our border is our first line of defense, and it is a source of concern. All these countries where we have red alert, like Brazil, Turkey, India, UK, where our Nigerians visit most frequently, they should ensure that people that come in from this point of entry and these countries, they are quarantined and they are tested. It's very, very important. So the federal government should scale up the surveillance, and then they should mandate the use of masks. It is time to mask up again. This is very, very important. And I think that we have not done so much concerning testing, which is very, very important when it comes to this variant. Because as it is, with the new variant, this Delta variant, new cases have been said to be risen by 70%, and hospitalization has increased by 36%. And I'm sure that is what we are having in Nigeria. Now, the federal government, we are not really testing to know if it is COVID-19 that has led to some deaths that we have seen. I can tell you that these 11 deaths that the government is reporting may not likely be the number of deaths that we have due to COVID-19. There are more deaths and more number of cases. So the federal government have to scale up the testing and surveillance on COVID-19. It is very, very important, because this virus, the spread of this virus is different from the signs of COVID. This Delta variant is different from other variants. For instance, this sense of smell, the loss of sense of smell, and the cough that we see with the other variants, this is not the symptoms we see with this new variant. So the federal government need to do a lot of surveillance, case tracing, and contact tracing to fish out those that are infected and quarantine and isolate them. It's very, very important, because this virus can spread. It has been found out that the transmissibility level of this virus is like 225% more than the other variant. And then because of this, the symptoms is not like others, so we may miss many cases. It means that the virus is going to spread widely and we'll have more deaths. So the federal government need to scale up its surveillance and then ensure that those that are eligible for the vaccine get vaccinated. Thank you.
A lot of issues which you have raised there. It looks like first the campaigns which went on earlier will have to be redone because if you're saying that the symptoms which characterize the first outbreak are different from that of the second, especially this particular variant, the campaigns definitely have to be different because then people were told, oh, coughing, if you experience coughing, if you experience sneezing, and things of the sort. So have you seen that concerted effort to alert the public that this particular variant is particularly different and that, you know, the symptoms which you might experience this time around, because let's not forget that cholera is also around. Gastroenteritis is being reported in some states. And if stooling and vomiting is one of the things that we're supposed to be seeing with this Delta variant, how do people now begin to differentiate them separately from, say, the COVID-19 Delta variant?
Yeah, that's a very good one. It's very, very important that the federal government reinvigorate the risks of communication risks of COVID-19. The populace need to know, need to be told the symptoms of this variant so that they have to be enlightened and educated on the risks, the transmissibility, because this virus, now, you know, before you used to say close contact, use face masks, but now the problem is that there are three important things that leads to the spread of this virus. Close contact is one. The second one is confined places because of lack of air circulation. And number three is crowded places. These three C. The most important thing is that the government need to communicate to the populace so that they will know the symptoms that they need to look out for, which is not like the loss of smell and coughing. So many people may think that it's not COVID-19 because the symptoms are different. So there has to be remediation of risk communication, improved surveillance, quarantine, and then sequencing, surveillance, sequencing, so that we will know the different strains that we are having that are causing the death and the new cases. So we need to communicate to the populace on the clinical features they need to see, they need to expect that is of this Delta variant. That is very, very important.
Dr. Ishaku, let me ask you two questions directly related to your field. First, we're seeing this particular variant. There are huge questions as to, you know, what has happened for this virus to mutate and becomes as deadly as it has. It's now even becoming even more deadly than it was before. One is about vaccines, because just a few days ago, we got over 4 million doses of Moderna vaccine here in Nigeria. And people are wondering, you know, it was seen that we're expecting different types of vaccine. We've had AstraZeneca, we're getting Moderna, we're expecting at some point Johnson & Johnson. Yeah, Johnson & Johnson vaccine. Only recently, Sinovac 2 was approved by NAFDAC, even though we don't know if we have, I don't think we've received any of the Sinovac. But I imagine that when they eventually come, that we will definitely accept them as well, since our own NAFDAC has put a seal of approval on it. How do you think that all of this numerous vaccines will work in our attempt to achieve herd immunity? Do you think that it's a wise idea to mix and match from different places? Yeah. Would that help our immunity levels? So
just like variety is the spice of life, so I strongly believe in the field of vaccinology, variety. So you have different vaccines that have undergone clinical trials. It has been established its efficacy and safety. So having different vaccines is not a problem, but it's about their acceptability. So one key thing now is that we need to work on the acceptability of these vaccines and their availability. Mahokwe, I strongly believe, just as an addendum to what my mentor said, Professor Mariam, is that we need a kind of a robust strategic communication, which is a component of risk communication. So a lot of people may think we have different types of vaccines, so we're not going to take these vaccines. And then the issue of even vaccine hesitancy is here with us. So we need robust strategic communication. And so I want to prescribe this, that what stops us from even involving NGOs to drive this process. I met people wearing face masks. I asked them, why do you wear face masks? It's because I want to enter the bank. Somebody just removed his face mask and he was talking to me. He said, no, I have to remove the face mask to talk to you so that you can listen to me. I said, no, you need to cover your nose so that you don't spread anything. So those are the things. Time has come, just like in the era of HIV and AIDS. We look for NGOs, we look for partners to be able to drive this process. And I think that time has come for us to actually look for partners in terms of strategic communications to actually drive the risk communication component of it. One. Two, we have been talking about testing. We have been under testing, which is quite sure. It is it is a non-fact nationally. Can we also get partners to be able to drive this process of testing? So I agree with you that we have like 5 vaccines now that have been approved. Their acceptability is going to be one thing, which it has to be driven by strategic communication. And secondly, the availability. We just have 4 million doses. I watched keenly the presidential task force, talking about the 4 million doses. But I know that quite significant percentage of people lost their second dose of the first batch of the vaccine. So what happens to them? Are we still going to contact them for their second dose, or they are going to start, a kind of a fresh exercise? So by and large, it's about availability and the acceptability of the vaccines.
So I don't know where we are in this battle right now, because, our borders are still open. And it would seem that a lot of the cases which we have experienced are coming from abroad. Look at the instance in Akwa Ibom, where they said that, they had how many cases overnight, and it was because of one returnee. And we understand that this particular strain spreads rather aggressively. I think 30% faster than the ordinary COVID in the first instance, and it's even more dangerous. Well, should we be looking at a closure of our borders again?
Yeah, so to me, closing border does not solve the problem. Closing borders will also, I don't want to look at the socioeconomic or the economic component of closing borders, but from the public health point of view, is for us to tighten our borders, our public health surveillance within our airports. I was here some months ago, and I said that what stops us from even having a testing panels in our airports? What stops us that for every returnee that is coming, we test immediately and we also do sequencing? Let me share something with you that will amaze you, although this is a national TV. A friend of mine was boarding, and he got his test results, and there was no test being done while returning from a nearby African country. No test was done, but a test was given to him.
Wow.
Do you understand? A test was given to him. So people have a way of, cutting corners. I may have somebody working in a testing center in the US, in the UK, in any part of Europe. I want to travel. I may ask him, hey, friend, can you get me a test batch, this thing? I want to travel back home to Nigeria. And then, so I want the federal government, the presidential task force, to think of establishing a testing panel in our airports, so that we can be able to actually go into that. Secondly, my mentor talked about sequencing. We are not only talking about testing now, we're talking about sequencing.
Before we get to sequencing, before you expatiate on sequencing, rapid test kits have been developed and have been deployed.
Yes.
Initially, there was a big debate as to whether or not we were going to accept the results of rapid tests.
Yes.
But now they are now being used even by the federal government.
In few states, just like the way she mentioned, in few states, and we don't have a national policy on a mandatory routine testing using rapid kits. So why can't we have a national policy on routine testing for the vulnerable? For example, for people that have, immunocompromised status of HIV, for tuberculosis, for pregnant women. So can we distribute this thing and have a national policy on testing or routine testing, just like the way you go to healthcare center, primary healthcare center, you get tested for malaria? Can we also, you asked my mentor on whether to differentiate between most of the signs and symptoms. The only thing that can be able to differentiate that is for us to have a national policy on routine testing, so that if somebody is passing diarrhea stool, you test him for COVID, you test him for malaria, you test him for other things. So we can be able to say, okay, let's have a national testing policy that COVID-19 becomes the first testing priority for any case of so A, B, C, D symptoms. And then from there, we can be able to nip it up. And then if the person is positive, we'll pick the samples for sequencing.
Let me quickly flip this to my colleague now. Ayo.
Thank you, Mokwe. Interestingly, both our panelists this morning are academics as well. The first question that comes to my mind right now, of course, to Professor, is, first of all, your primary constituency in the schools, the students themselves, what can you tell us about the level of acceptability or understanding of the issues that we're dealing with, especially concerning COVID-19, especially among the students that, you know, that you have to interface with on a daily basis?
Thank you so very much. We resumed on Monday. I was in the class yesterday. I can bet you that half of the students in the class were not wearing face masks. I had to enforce it to say that every student that is not wearing this face mask should go out and pick the face mask. You know, it's just lack of belief. I had to tell them that I have been vaccinated. I've taken my second dose. This is the issue of COVID-19. In fact, I was teaching introductory virology. I had to take 5 minutes to let them know the reason why they should wear face masks and pass the knowledge of what I was going to teach them. Do you know what? Even amongst colleagues, every day I find myself battling with them, trying to convince them that there is COVID-19. It's just lack of belief. Some colleagues, some medical doctors don't even believe in COVID-19. I don't just know why. Maybe because now I'm sure with this third wave, they are seeing people dying now. You know what? I want to let you know that it's because we are not telling ourselves the truth. Many Nigerians have been infected. We don't have the data. We are not telling them people die of COVID-19. They keep it secret. They will not say that this person has died of COVID-19. They will argue with me. What are the symptoms? We don't see anybody. Have you ever seen anybody in the hospital with COVID-19? They have never seen any patient. I'll tell them I'm a good example myself. I have been vaccinated. I've taken first and second dose. I know what it is. And there's nothing has happened to me. It's just, do you know what? The key, most important thing is that we have to communicate. We have to communicate the risk communication to the populace. We have to let them know that COVID-19 is real by telling the truth. Those that have died of COVID-19, I can tell you that I have lost a very, very close mentor to COVID-19 in the last week. But nobody is saying that that person died of COVID-19. So many people think that it is a hoax, it's lie, COVID-19 is not real. Even among colleagues, they feel that we have many false positive results, it is something else. The truth needs to be told. People should come out and say the truth. Maybe for the first time, I want to say it in national television. I was infected in November of COVID-19, and I know what the symptoms are, and I feel it. I think if we don't tell ourselves the truth, and if I'm able to say this on national television, if 1 or 2 persons listening to me and say, oh, if Professor Mariam was infected, and it means that she's saying the truth, I know the symptoms. People should come out and say the truth. If people die of COVID-19, Nigerians should be able to say, these are the people that have died. We're not telling ourselves the truth. COVID-19 is real, but many people do not believe it. Among students, colleagues, lecturers. So we have, like we said, we have dropped our guard. That is why we open our borders. We allow people to come in without quarantining them, and this is what we are having now. In the last 1 week, the virus transmission of COVID-19 by PCR has increased from 1% to 3.4%. It means that in the next 1 month, there will be many more deaths due to COVID-19. Well, it's Prof, very important that we educate the public on COVID-19.
Yeah, well, you've raised so many issues even in this passionate response, but there are so many other things to deal with. How did we even get to the point where people don't believe the authorities any longer? Well, that's one of several things that we'll be looking at, but only when we return after this list of communication to you. Do stay with us. Thanks for staying with us. Dr. Ishaku, I'm pretty sure you are as concerned about the same issue, especially the fact that among students, it would seem like it's just business as usual. I mean, juxtapose that with the lead of the Daily Trust newspaper this morning that talks about so many NYSC members who are already tested and have been confirmed positive for COVID-19, among several others in the country. Perhaps the challenge then is, how are we communicating with everybody, especially the students?
So I thank you for bringing that to bear. I was part of a committee to actually speak with some young youths in my in the NYC camp in my state about COVID-19. And one of the things I have discovered a huge gap is that we need a targeted strategic communication for the youthful population. And how do we need to achieve that is to actually review our curriculum for health education. When we are coming up, we actually went through health education, but may I tell you now that health education is not taken as modules in our primary, secondary, and tertiary institution. And I think that we need to review that. I was thinking that before the lockdown or after the lockdown, we would have reviewed certain curriculums in our education curriculum and then make it mandatory for health education to be mandatory for all levels of education. So I see a very huge gap. I see a population of youths that are always on the internet and, garbaging in a lot of information, misinformation about COVID. Do you know that from my initial lecture with some COP members in the NYC camp, I asked them just to sample their opinion. How many of them believe that COVID-19 is real? Only 2% raised up their hand that COVID-19 is real. Some, I asked those that did not believe that COVID-19 is real, why do they think that COVID-19 is real? Some of them told us that it is a conspiracy theory from China. A lot of them attributed that to lack of social trust on the side of the government. It is a ploy for them to be, locked, over months, over weeks, and all what have you. So we need to actually communicate well, because we are dealing with a generation, a millennial generation, that spend more time on the internet than even with their colleagues physically. So they engage.
You raised a critical one there, Dr. Ishaku.
Get a lot of information.
Well, just 1 second, Dr. Ishaku. You raised a critical issue there. You mentioned distrust, of the authorities by the people, and it would seem like that distrust has gone so far as to, look, you know what? We don't even believe anything government says, anything the authorities say. They do not matter to us simply because we do not trust. And this is also now getting to a space where even if the information you are giving me is going to hurt me, I'm not going to believe you. Now, that's a very, very dangerous spot. I'm pretty sure you will agree. So how do we get out of that rut? Because it is one thing for us to give out information. Communicating that information, now that's another thing altogether.
So quite a valid question you've raised over there. So what we just need to do is, if I asked what was the role of National Orientation Agency in the fight of COVID, we've not seen their input so loud. And I think that the National Orientation Agency needs to actually step up in terms of bringing strategic framework in order to reach out in terms of the risk communication. The role of Ministry of Communication, Information is quite key. And I think that is what these two ministries need to come together and to be able to form synergy with the Nigerian Center for Disease Control and the National Primary Health Care, come up with a model on how to be able to achieve that. They may also employ private sector to be able to drive that process. I am also thinking that we can be able to raise COVID-19 ambassadors. People like Maokwe can be able to be appointed as COVID-19 ambassadors. Professor Mariam over there can be appointed as COVID-19 ambassadors. We have a lot of religious leaders. We have a lot of celebrities that can be able to be appointed as COVID-19 ambassadors. So could we imagine that our youth trust information from BB Niger even more than from their government? So we need to overhaul and then begin to come up with a strategy to be able to reach out to this youthful population and begin to bring back the trust. So by and large, a lot of agencies that are saddled with the responsibility of communicating, they just have to come up with a strategic communication.
All right, Dr. Shaku.
Indeed, COVID-19 has actually opened up gaps.
Yeah. Let me ask beg your pardon, Professor Aminu, because one of the things that I've also seen is perhaps, you've talked about the fact that trust is a main issue. Could it be, Professor, that we speak above the people sometimes? About half the population of Nigerians are poor. They are dealing with so many, economic gaps, in their lives. That's on the one hand. Education, about the illiteracy level in the country. Could we have been speaking above these people and also, suffering from infodemics in line, or rather in cahoot with this pandemic?
Wow. Majority of individuals, they don't even listen. Like now, may not even have TV to listen to what we are discussing. Majority of them are in the remote areas. I think you are right to some extent. Like Dr. Akiala said, we need to communicate to the people that matter in the right language they will understand. It's not only to go to National Assembly or in Abuja, in a town hall and talk. Others, these populace that matter, most of them that go to the market, mix up, they don't listen to television. We need to find means of communicating to them, the means that they will understand. And that majority of these students and these populace, they believe those things they see in social media. They are not so enlightened enough that they will listen to what we are saying now. But what if one particular person, maybe their imam or the pastor, tells them this is it, or maybe the head of the family, and they believe that? It is very, very important that we communicate to those that matter in the language, in the way they will understand it. And we should communicate properly to them. I've had jingles. I've had write-up. The jingles in Hausa, in Yoruba, in English. Many of these populations, they listen to radio. So they listen to me, they listen to that, but they don't watch television, they don't listen to, they don't come to attend all these maybe COVID-19 sensitization seminars. But we have to communicate to the populace that matter in the language and the way they will understand. I think that is very, very important. And then, we have problem. The problem why they disbelieve is because of what they see in the social media. Remember when it came to this vaccination, they were saying that when you put key, it will stick to your arm. When you put a lamp, they believe this so much, even among those that are enlightened. They believe everything they see in the social media. So we must find a way, just like Dr. Akiala said, for all those communication agencies to try and see that all these conspiracy theory, they counteract it, and they also go to social media to pass their message in social media where this individual listen to. They should also strategize to find means of getting to these important people that will spread, if one person become infected, that will spread the virus in the community. They should also use the means for communicating of this, vaccine, vexers. They should also communicate using social media. I think that will solve the problem to some extent.
Well, that's the hope, of course, especially now that Twitter has been suspended. One wonders if that's something that government would be considering. But, you know, one other issue along this line, Professor, that touches on, you know, whether or not we're able to get ahead of the issue would be the funding for the entire health sector and COVID-19 as well. We've talked about cholera outbreak. That's, you know, the figures just seem to be, you know, on the rise. Just how many hours or days ago we heard that there's this outbreak of some gastroenteritis in Sokoto State and so many others. And if you look at the budget for the nation this year, it's just 4.526% of the budget. Contrary to, you know, something that should be more than 10%. And so one wonders if indeed, with that kind of paucity of funds, will we be able to do the core things of getting infrastructure, adequate infrastructure for the health sector? NARD members say, as far as they are concerned, we do not have enough isolation centers all over the nation. The personnel that should be dealt with, that should be treated fairly, the welfare for the people, the health workers who are on the front line of this war we are fighting. NARD members, for instance, now are on strike. And communicating these risks to the people. Do you think we have a funding challenge, or you think with what we have, we should be doing okay, Professor?
I can tell you that when it comes to health, we are underfunded. I don't know. I should think that health, it should be priority of the government. We should not have the NARD going on strike before the government see to their need. These are important individuals that are the frontliners that are fighting. That when you come to the hospital, these are the doctors you will see that will first of all receive individuals. They are putting their life to ensure that they save individuals. Just why can't the government think twice to say they should not even be demanding for their basic need? It should even be provided and given to them without asking. Like they said, it is true. We don't have many isolation centers. We don't even have the facilities. We don't have the personnel. I remember we don't even have all these things. I think when it comes to health, it should be the first thing, the paramount thing in the government, especially now that COVID-19, the third wave is coming. We are in the third wave. In fact, the first thing I think the government should do is to settle the NARD, to settle their demand. That should be the first thing, and ensure that all the oxygen demand is improved on. Everything concerning COVID-19, what we need to do, not even only COVID-19, surveillance is put in place. All the infrastructures are put in place for healthcare problems. This is very, very important. I see no reason why the government should not be providing what is needed to fight diseases. But perhaps maybe because they are not seeing the number of deaths that we have seen in other countries. I'm telling you that if they allow COVID-19 to spread in the community, we are going to have crisis in our hands. The healthcare will not be able, the facilities, our healthcare will not be able to take care of what is going to happen. So as it is, the government needs to scale up and ensure that they do the needful when it comes to improving and healthcare facilities, and demand of these doctors is very, very important. This is one thing I think they should take serious. They should take that very, very serious.
Okay. Well, one would be glad, of course, that the Presidential Steering Committee is doing all that they can. I mean, these issues of inadequate infrastructure is not unknown to the team, given the comments ascribed to the chairman of that team last year. But let me ask you, Dr. Ishaku, one of the issues around COVID-19 in Nigeria, as well as other health challenges that we have had in the sector, is that of research. A number of people have drawn concern about the vaccines. You are not unaware of that as well. Which one should I take? Which one should be mixed? Which one should not be mixed? And all those things. And then, is the Delta variant going to succumb to the power or the potency or efficacy of any of the vaccines that's making the rounds now, given that the first strain was the reason for which the vaccines that we're using now have been made. And this is the third strain, which we understand is the most virulent so far. So the issue of research in our country, is something that needs to be, that we need to give a little bit more attention, because one is wondering, on the one hand, we are saying people should go do the needful as far as COVID-19 is concerned. But then many people do not believe. And then the people are wondering, we're not dropping dead, we're not having so many fatalities in the country. Perhaps some research findings in our country could help to find out, why are we having the kind of results that we're having, or are we just lucky?
So I agree with you that research is quite key in the fight of COVID-19. I hope you also know that 21st century is a knowledge-driven century where research is quite key. Even vaccines that we are having now are product of research. Even testing kits that we are having now are product of research. So we need, just like Professor Mariam, my mentor, said, we need funding. Research is quite key. In fact, funding should not only come from the government, funding should also come from private sectors, multinational companies, because this is 21st century, it's knowledge-driven. Gone are the days where we should have professors of mechanical engineering that should be able to fix our gearbox that are failing, not to be taking their cars to roadside mechanics. So this is quite key, that even the research component needs to be funded. If you go to advanced country in other climes, you will find out that they have pumped billions of US dollars on research, and research is quite key. So, and research in the 21st century is multidisciplinary in nature. It is not only restricted or stereotyped to the core sciences. So people in social sciences are also involved. We need people to be telling us, why are people behaving the way they are behaving? Why are people not wearing face masks? So what is wrong with the behavioral changes? We also need people in the acts of communication to tell us, why are we failing to communicate well? So it's a whole lot. So I agree with you that funding should be key in the fight of COVID-19. But the sad reality is this. Over the time, I've checked a lot of platforms and a lot of lexicon in terms of journal publications. I've not seen quite strong data emanating from Nigeria or published by researchers in high-impact factor journals because of funding. One of my mentors called me yesterday evening and he was telling me that one of his papers was accepted to be published. And the publication fee was $2,000. And he calculated that that's close to ₦1 million. And that's his salary for 6 months. And then he has to pay by himself. So you find out that it's quite a whole lot. You go to our university today, you discover that we are graduating people in the core sciences that have never had expertise or skills in terms of laboratory diagnosis, in terms of testing, in terms of bringing out analytical skills. We need to actually fund research, not only because of COVID, because of other infectious diseases. I was involved in cholera outbreak in my state some weeks ago. I can tell you that there are more deeper issues than cholera that we are seeing. And funny enough, cholera, issues of gastroenteritis are disease of poverty, because the government needs to provide potable drinking water for their citizens. But we barely in most state capitals, they don't even have potable running waters. Most of them, the pipes that are being laid on the ground have expired, have gotten rotted, and then, you know, they are contaminated. Nobody is checking the quality of water that people use. You see proliferations of boreholes, and even boreholes are being sunk closer to you so there are a lot. So we need to fund research, and it's quite a lamentation. You can see even from my expression. I am coming from the academic background that, you know, funding of research is something that we need to actually look into it, and then be able to see for the way forward. So in the coming days, could you imagine COVID has stayed with us for over a year? No any Nigerian was able to provide or design a testing kit that is localized to us.
Yeah, some people will say that sometimes maybe that people in-house to have also neglected opportunities. For instance, TED Fund, they have been calling for researchers. They have been asking, they're willing to now fund more researchers. I do not know if there's been, will I say, a change of focus to some in-house institutions who will be willing to fund research.
So, Mark, we've gotten COVID now for over a year. Have you ever heard that a beneficiary of TED Fund for COVID research? Or you heard of a beneficiary of NCDC grants?
No, the question is, have we applied?
No, so the issue is that we need more windows to be opened. Mark, maybe this is a national TV, but let me just lay this cut out. There are a lot of policies also, politics also in terms of disbursing funding for research in Nigeria. Sometimes it's not by merits. Sometimes we even disburse funding research grants based on regions, based on federal character. It's not supposed to be so. Funding for research should be merit-driven. I was just watching this morning discovery of 2022 model of a lot of cars, and a lot of marine biologists have to travel down to snap octopus, their eyes, to look at how they design headlamps, and then come back to the lab and design, and this is how we get models of phones and all what have you. We need to fund research on merit grounds in this country so that we can be able to have made in Nigerian goods, made in Nigerian products, so that it is quite key. We have talent, we have people. Nigeria is endowed by human resources that needs platforms. We also need multinational companies. We are talking about strategic communication. So I may ask, what is the role of our telecoms even in dishing out information for COVID? I should be able to check my balance of my MTN card or Glo or Airtel, and then beneath the card, I should be able to say a capture that talks about COVID, like that. I should be able to say that we can be able to do a GIS mapping. The moment you enter your Facebook, by default, your status or your profile picture should change to a COVID status. So that can be done.
There are many suggestions. Maybe they need to just have more heads on the table. Let me quickly ask Professor Aminu, as we now wrap up, whether she'd like to add anything to the talk on research, and whether there have been any attempts in-house to try and get from Nigerian institutions who are willing to fund research. That's one. And the second, whether she agrees that the incentives been given, or disincentives more or less, especially for those who are coming from international trips. You did hear the SGF, I don't know if you heard him, towards the end of the report we played on this program, saying that there will be sanctions, restrictions on people who do not go back for their 7-day testing, 6 months restrictions on the international passport, and for those who do not observe the quarantine, 1-year restriction on the international passport, whether you consider that a sufficient disincentive for people, or incentive more or less, I don't know, whichever way you want to read it now, for people to be able to observe the protocols, especially those who are coming from international travels. Prof.
Thank you, Mope. Well, I want to say that maybe Dr. Ishaka may not be aware of it. I and some other group, that is Professor David Olaleye, that passed on last Tuesday. That was a week, about 8 days ago. He was the principal investigator of a TED Fund grant we received to develop a a simple PCR kit to test for COVID-19. We got that research grant and we are working on it. In ABU, some individuals, we applied for some research grant concerning COVID-19. Unfortunately, some people didn't get it because of the bottleneck, because of the reasons he mentioned. There are a lot of bottleneck and so many things concerning getting the third fund grant. I think those should be improved on. As he said, it should be based on merit. But there is one that is ongoing to develop a simple PCR kit. And we're on it. Late, may he so rest in peace. Though he passed on, he was the principal investigator. And concerning the incentive or lack of incentive, I think the first thing, what they should do is that they should ensure that they quarantine the travelers that are coming from this red alert country. Putting the sanction is, I think, is quite okay, but then they should ensure that it applies across all categories of people. One thing, my brother came back from Turkey. He was quarantined. I was so happy, and I told him, it's good for you. You should be quarantined because it's a red alert country where the Delta variant is very, very common. He was quarantined. He did the test. He repeated the test after 7 days. But what I want to say is that if they have to implement that, they should implement it across all board. Everybody should go through the same treatment. They should not just say, because this person is this, to allow some people to go. I think that is where we miss it. That is where we got this COVID-19, this Delta variant tonight, because they allow some people to leave while they quarantine some people. Thank you so very much.
Prof, I have to thank you so much for your contributions on our program this morning. Professor Miriam Aminu is the head of Department of Microbiology at Ahmadu Bello University, Zaria, and also the Deputy Dean, Faculty of Life Sciences at the same university. Thank you so much for speaking with us this morning. And Dr. Akelia Ishaku is an epidemiologist and also a senior lecturer at the Nasarawa State University. Thank you so much for coming, Dr. Ishaku. We'll have to take a break at this moment. When we come back, we'll be sinking our teeth into another issue. Please stay with us.